Medicare has proposed a Medicare CQM to make compliance with the APP, that is the APM performance pathway, easier over the next few years. So, Dr. Mingle, do you think we should use Medicare CQMs for our ACO if this proposal is finalized?
Great question, Arline. I think that Medicare CQMs will be a valid and useful tool, but it will not offer a big advantage over MIPS CQMs. Medicare proposes Medicare CQMs as an alternate quality data collection type for Medicare Shared Savings Plan, that's the MSSP, ACOs to meet the requirement of the APM performance pathway, that's the APP. The proposal is that Medicare CQMs will use the same measures with the same specifications as MIPS CQMs, but they'll restrict the denominator patients to Medicare Part B beneficiaries, setting aside the all-patient, all-payer inclusiveness of MIPS CQMs. To support this and provide a tool to help ACOs aggregate and deduplicate patients across their practices, Medicare proposes to provide a list of performance year Medicare Part B patients of the ACO to the ACO early in January of the submission season. Now, Medicare patients is helpful, but it's not an enormous help to you. It can't be your sole source of your patient list because it will only include patients through the third quarter of the performance year. And the process of matching those patients on the list to the patients in each of your claims data sets or even your EHR data sets is still a similar process with or without that data set. If you're working with us and we have claims data from each of your practices, we have enough to deduplicate your patients. And by filtering on Medicare Part B claims, we can easily toggle between Medicare CQM and MIPS CQM submissions, telling you in advance how you may perform on each. As we envision the process of using Medicare's patient list to assist the process, we don't see a substantial additional effort that gives you a distinct advantage. But still, there are advantages to the Medicare CQM. If you have to manually abstract some of your charts to meet your data completeness requirements, or you need to uncover electronically inaccessible positive performance data, the Medicare CQM route gives you a far smaller chart set or data set to abstract than does the corresponding MIPS CQM. It's also credible to think that there are enough differences in the Medicare Part B patient and care dynamics that there might be a better performance score found in your Medicare Part B limited patient population as there is in your general all patient, all payer population. Although there's also a possibility the reverse is true, and that your general population may be performing better in some measures against your Medicare Part B patients. Thanks, Arline.